Now coming to the definition, cardiac tamponade is the accumulation of excess fluid in the pericardial space. Cardiac tamponade is a life-threatening condition caused by the fluid buildup in the pericardial space. As you can see in the picture, there is increased pressure in the chambers of the heart due to the accumulation of fluid.
Cardiac tamponade can occur due to dissecting aortic aneurysm, end stage of lung cancer, heart attack, acute myocardial infarction, heart surgery, pericarditis caused by bacterial or viral infections, and wounds to the heart.
Now coming to the anatomy and physiology part. Human heart is a four-chambered hollow muscular organ. It has three layers: endocardium, myocardium, and pericardium. The four chambers are right atrium, the left atrium, the right ventricle, and the left ventricle. It is covered by a fibrous layer called pericardium. This sac has two layers, the visceral layer and parenteral layer.
Now let's discuss on the risk factor of cardiac tamponade. So under the risk factor, the first point is the cardiac trauma. So as we all know that cardiac means the heart and trauma means the injury. So here under cardiac trauma, the first point is open trauma to the thorax. So open trauma, it may caused by like some kind of gunshot wounds or stabs. Gunshot wounds, we all know that that is a wound which is caused by the bullets or something, and stabs means the wounds which occur by some sharp instruments like scissors or knife. Then the second one is the close trauma to the thorax. So in the first point, we have already discussed that about the open trauma. So open trauma is obviously caused due to like some cuts by the sharp instruments or by the bullets. So the second point is a close one. So here nothing will be pricking the body, but here in close trauma it may occur by the impact of the chest on the steering wheel during a motor vehicle accident. So by that maybe you all will understand what is the difference between the open and a closed trauma. Then the third point is the cardiac surgery. Then the last point is the iatrogenic causes. So iatrogenic causes is it is due to the physician or some kind of medicine. For example, cardiac catheterization. Cardiac catheterization is the insertion of a catheter in the chamber or vessel of the heart. We all know that. Maybe like as example as a pacemaker electrode perforation. Then next let's discuss about the pathophysiology. So now next let's discuss about the pathophysiology. So here, due to the accumulation of fluid under high pressure compression cardiac chambers, it impairs diastolic filling of both ventricles. So now let's talk about the pathophysiology. So here, due to the accumulation of fluid under high pressure compression cardiac chambers, it impairs the diastolic filling of both ventricles. And due to this, it results in the decreased stroke volume, which leads to decreased cardiac output. Then automatically it leads to hypertension, shock reflex, and tachycardia. It even leads to increased venous pressure, which leads to systematic JVD, which is the jugular venous distension, then the hepatomegaly, which is the enlarged liver, then ascites, which is the swelling of the abdomen caused by accumulation of fluid, then the peripheral edema, which is the accumulation of fluid which causes swelling. Then the increased venous pressure also leads to pulmonary congestion, which leads to rates. Rates is the abnormal heart rate or sound which is heard during examination.
Now coming to the signs and symptoms. Signs, it includes 3Ds: diminished heart sound, distended or jugular vein, and decreased BP. Jugular vein is due to the increased venous pressure, making it visible on the right side of the person's neck. Now coming to the symptoms, a person with cardiac tamponade may show symptoms such as dyspnea, abdominal pain, fever, cough, palpitation, chest pain, weakness, and shock. And in diagnostic evaluation, first we would check the history of chest trauma, and second, pulsus paradoxus. Pulsus paradoxus is an abnormal large decrease in stroke volume, systolic blood pressure, and pulse wave amplitude during inspiration. And third is there is narrowed pulse pressure. And number four, in neurologic, it causes anxiety and confusion. Continuation of diagnostic evaluation. In cardiovascular system, we can see jugular vein distension, reflex tachycardia, muffled and distant heart sound. And in skin, cold, pale, and clammy skin can be seen. An echocardiogram can be used to produce images of tamponade heart. And here we can see dilation of the IVC that is less than 20 mm in adult sized heart, and hepatic veins dilation can be seen.
Complication: acute ascending aortic dissection of cardiac tamponade, pulmonary edema, shock, and death.
Management. Pericardiocentesis. Removal of fluid from the pericardium. Pericardial window. For continuous drainage of fluid from pericardial space. Oxygen administration. Bed rest. Volume expansion with blood plasma or IV fluids. Entropic drugs. Example, dopamine for treatment of cardiac decompensation due to decreased contractility.
Nursing diagnosis. Number 1. Decreased cardiac output related to reduced ventricular filling. Secondary to increased intrapericardial pressure. Number 2. Ineffective breathing pattern related to hyperventilation. Number 3. Ineffective peripheral tissue perfusion related to decreased blood flow secondary to cardiac tamponade. Education. First, advise the patient to follow up with healthcare provider or a cardiologist. Second, advise to manage other health problems as it can increase risks for cardiac tamponade. And number 3, advise to contact the healthcare provider if there is swelling in the ankles, leg or abdomen, and if there is bulging veins in the neck or head.
Conclusion: cardiac tamponade is a life-threatening condition that is not common in the oncological setting. It can be resolved directly from the malignant process from the treatment of the malignancy, observation and promote intervention and mandatory to deal with the cardiac tamponade.